We chose the clinical scenario where we are community health nurses that meet monthly with the teachers in our primary school district. At today's meeting, they were concerned about the news reports they read online about the rise in number of children with measles in Alberta. They don't understand why some parents choose not to immunize their children against childhood diseases such as measles, mumps, and rubella. We think, wow, this is a very interesting question, and offer to provide them with a brief overview of the research evidence that addresses their clinical question at next month's visit. Things we really wanted to focus on were the parents' perspectives, whether or not they changed their mind after receiving new information, and how we as healthcare workers could help them inform their decision. Our PICO question: what factors contribute to vaccine hesitancy among the parents and guardians of primary school children in Alberta?
Now, here's our rationale and process for developing the PICO question. First off, we started by thoroughly analyzing the scenario and identified the main problem that stood out to us. We found that the overarching problem was confusion surrounding why parents weren't choosing to vaccinate their kids. We used this issue to each come up with our own PICO question and then collaborated with each other to refine it down to one question. This process allowed us to reflect all of our perspectives and answered our problem regarding vaccine hesitancy along with the population, which was parents of school-aged children in Alberta.
We used a couple of different strategies to conduct our research. Firstly, some of us use Google Scholar while others use U of A's library site, but we started with search terms like vaccines for children and school-aged children. This helped narrow our search to our PICO population, since our question directly asked why school-aged children, and not infants, have dropping vaccination rates. As well, we used vaccine hesitancy as a search term so we could research the vaccine hesitant population of parents described in our PICO question. Searching for qualitative or quantitative helped us avoid meta-analyses. Some of us started by using those same search terms to find a meta-analysis. Reference list of that meta-analysis led us to some fantastic primary articles about the motivations behind why a parent may choose not to vaccinate their child.
During our research phase, each of us ran into issues which required us to use different approaches to find information that is appropriate for our research topic. We found that putting search terms such as vaccine hesitancy, parents, whether we wanted qualitative or quantitative, and specifically searching for schools helped us meet the PICO question better. While we used search terms to narrow down the search, some of us also needed to broaden the search, such as putting childhood vaccines or immunizations instead of primary school, since primary school was not general enough to find good results. Searching for our target demographic, some of us found that Alberta was too niche. Others who didn't include their target demographic into their search found results that were too global and worldwide.
Determinants of parental vaccine hesitancy in Canada. Results from the 2017 Childhood National Immunization Coverage Survey. This study was a quantitative cross-sectional study which included 6,463 parents with children aged 2 years only. One of the top characteristics is that it was mostly females who participated. It was also made up mostly of non-immigrant parents with incomes of $100,000 or more and were university graduates. This study aimed to identify national child vaccination status and the socio-demographic factors related to vaccine hesitancy or refusal among parents in Canada. The researchers found this was important because vaccine hesitancy is one of the top 10 leading threats to global health, and they hoped it could improve vaccination programs. This study was similar to our population of interest as it included Canadian data and was all about vaccine hesitancy or refusal. Now, for the differences compared to our population of interest is that it was only about children who were 2 years of age, whereas we were looking for primary school-age children. Alberta only made up 9.7% of the data, and it also didn't include the Indigenous community or reserves. For gathering the data, they used computer-assisted telephone interviews, and also later assessed the child's immunization record. The interviews were voluntary, and they asked the parent with the most knowledge about the child's vaccine status to answer. They used KAB questions to direct the interview, which were about knowledge, attitudes, and beliefs. And to assess the data, they used a multinomial logistic regression model. This model is best used when there are multiple categories with no ordinal rank, which is why this model helped them associate the factors together. Now for the outcomes of interest, their main question was, have you ever had your child vaccinated? They used closed and open-ended questions to assess whether the parents were vaccine hesitant or not, and why. One example of a multiple select option was, to what extent do you agree or disagree with the statement that the flu is not a harmful disease? Now moving on to the top key findings of this study. For the parents with high vaccine hesitancy, they made up 17.4% of the parents. Some of the top socio-demographic factors related to high vaccine hesitancy was that the mothers were more hesitant than the fathers. It was also higher in non-immigrant parents, low household incomes, and parents with 4 or more children. Some of the top regions were Quebec and the Northwest Territories. And the top reason for being hesitant was about vaccine safety. The others were more hesitant about the vaccine's usefulness and effectiveness. Those who refused the vaccine and have never had their child vaccinated made up 2.4% of the data. They were found to have low household incomes, had more children, and were in the regions of Quebec, Manitoba, and British Columbia. Finally, those with lowest vaccine hesitancy was immigrant parents and found more in the Atlantic region of Canada. Now, for the critique. The main factor that was not accounted for in the study was the lack of representation of the Indigenous community and reserves. Considering it was a national study, it should have been inclusive of everyone and the population as a whole. The limitations that were acknowledged by the authors is that it was a self-reported study, which opened it to recall bias. This is if the parent doesn't accurately remember the correct information. Another limitation was that it's possible that the parent with the most knowledge of the child's vaccines wasn't actually the one making the decisions, which may have limited their findings. Finally, the interviews were only done in English or French, and those that didn't speak either official language was excluded. Now, how does this relate to the PICO question? Well, the study provided us with statistical information and the top socio-demographic factors related to vaccine hesitancy. It also helped us identify how gender, income, region, and number of children shape the parent's decision to vaccinate their child or not.
Study number 2. This 2019 article published in the BMC Public Health Journal looks at maternal perceptions of childhood vaccination, explanations of reasons for and against vaccination. Sample characteristics. Data from an ongoing longitudinal pregnancy study called the All Our Babies Study was used to recruit 1,560 Calgarian women in their second trimester of pregnancy. Most participants were Caucasian, Canadian-born women who were younger than 35 and well-educated, married or in a common-law relationship, and had household incomes above the Calgary median. Study design. This was a qualitative longitudinal study, and researchers used surveys to get data from participants during pregnancy and postpartum at 4, 12, 24, and 36 months. Outcomes of interest. Researchers asked mothers about their reasons for immunizing or not immunizing their children. Their narrative responses were then analyzed and categorized depending on their level of conviction and motivation. Some parents were very confident with their choice, while others weren't so sure, and vaccination decisions seemed to be intrinsically or extrinsically motivated. Key findings. Those who completed their children's vaccinations on time were positively influenced by their own personal or family experiences. Information from healthcare workers caused many parents to vaccinate their children, but some parents felt pressured. Reasons for not vaccinating included negative experience with vaccination, beliefs that the risks outweighed the benefits, and parents questioning vaccine efficacy. Some parents had concerns about vaccine ingredients, a fear of autism, and lacked trust in healthcare organizations and government. Alternatively, those who vaccinated showed trust in these systems and their healthcare provider. Parents for and against vaccination reported doing research on their own, and neither side felt like they needed more information. Critique. Participants who discontinued the All Our Babies study, which sampling for this study was based on, tended to be younger, non-Caucasian, foreign-born women with lower income, who had poor early pregnancy psychosocial health. This limited the study's generalizability to those demographics. The understanding of vaccination perspectives was limited, as data was taken from text responses to a survey, and there was no chance to ask for more in-depth responses. The categorization of responses based on motivation and level of conviction must be interpreted with caution, as the author's assumptions were not thoroughly tested and explored. This study was relevant to our PICO question, as it focused on the vaccination decisions of Albertan parents, many of whom were vaccine hesitant. Although the study looked at immunizations for infants rather than primary school children, it still allows us to better understand the factors that cause parents to not vaccinate their children.
Nature does things well. Why should we interfere? Vaccine hesitancy among mothers is a qualitative study performed by Dubé et al. In 2015. The study asked why mothers would choose whether or not to vaccinate their children. The study interviewed 56 women in Quebec using semi-structured interviews and open-ended questions. These questions were asked by a third-party interviewer to avoid healthcare bias. These interviews were conducted in the second or third trimester of the woman's pregnancy and 3 to 11 months postpartum, to gauge whether the mother's stance on whether or not they would vaccinate their children had changed. Previous interview answers and current events were used to ask more informed questions during later interviews, such as asking about nearby outbreaks of vaccine-preventable diseases. Previous studies have shown that midwives discourage vaccination more than physicians, so since the study was deliberately seeking the vaccine-hesitant side of the story, they chose to interview an equal number of women under the care of midwives. However, this makes the study less generalizable since only 5% of Quebec's pregnant women are under the care of midwives, not 50%. Bearing in mind that the study's participants are volunteers, one critique of this study is the elevated risk for selection bias. Selection bias results when the study population is not randomized, aka the population volunteered for the study, and often results in only those with strong stances on a subject providing input, thus making the views of the general population seem more polarized than is the case. Social desirability bias is also a risk for the study because the mothers being interviewed may only be voicing opinions that they feel are logical and that they believe the interviewers want to hear, as they are afraid of being judged. This study addresses our PICO question by investigating the motivation behind vaccine hesitancy. The population of Quebec mothers is similar to our PICO population because the study explored Canadian parents, vaccine hesitancy, and parents' rationale behind their vaccination decisions. This study differed from our PICO question because the parents are from Quebec, not Alberta, and the study investigated infant vaccination rates, not the vaccination rates of school-aged children. The biggest takeaway from this study is that vaccine-hesitant and vaccine-unfavorable moms are not monsters who don't care for their children or the safety of others. They have logic, reason, and simply put an emphasis on different aspects of vaccination. For instance, they may see vaccination and its potential side effects as higher risk than the mild disease the vaccine prevents. Vaccine-hesitant moms may make their vaccination decisions based on an individual risk versus benefit analysis and